Hey everybody, Dr. Tammy here from 100% Natural Baby. I'm very excited to share this topic with you today, one of my very favorite subjects, and it is the most essential key to getting pregnant, achieving your pregnancy, and maintaining your pregnancy, and that is hormones. I've kind of become known as a little bit the hormone queen, and this information is going to be very important for you to understand. Part of this all comes together in 5 main things that you need to know to empower yourself to get pregnant. I have so many patients say that they've gone through the whole infertility route and the doctors can't tell them why they can't get pregnant or why they can't maintain a pregnancy or they have miscarriages. So these are some essential things that you have to know to empower yourself. Your genetic status, your nutrition status, your hormone status, the impact of stress on your hormones, and your immune function status. Just want to let you know that if you're struggling with fertility issues, you are not alone. There's over 1.5 million married women ages 15 to 44 who are diagnosed infertile. That means they're unable to get pregnant after at least 12 consecutive months of trying. So that's 10% of all couples. 7.4 million women ages 15 to 44 have sought infertility services, so that's huge, and it's a multi-billion-dollar industry. Infertility drugs are dangerous, and the treatments are a multi-billion-dollar industry that has everything to gain from your failed efforts. It's no wonder you're confused, and even worse, haven't achieved the pregnancy you've sought. If everything is structurally in place, meaning you have all your parts and your husband is healthy, then you should be able to achieve pregnancy naturally, but there's a lot that you need to know first to empower yourself. The first thing you need to know is about hormones. Getting your hormones balanced doesn't require your life savings, countless trips to the doctor's office, or dangerous drugs, painful procedures, or synthetic hormones. I'm Dr. Tammy, and I have dealt with women with hormone issues for many, many years, almost 15 years now, trying to get them in balance and helping them. I've written books, talked with celebrity experts, and what I've come to understand has helped me to be able to help you, but more importantly, my own personal struggles through 13 years of infertility and pretty much a lifetime of female hormone problems has led me to want to understand, to get outside the box. I'm a board-certified family physician, and I don't do any regular medicine anymore. I mostly just help people get their hormones balanced and get their life back. The biggest thing I think I do is empower people to understand what's going on in their bodies so they can take responsibility and take charge of their health care and achieve whatever goal it is they want. So if fertility is your goal, then absolutely this is the first step in understanding. So having struggled for 13 years to get pregnant, I understand what you're going through. I remember all those years wanting a baby. I dreamed of snuggling with my baby and how it would feel to hear the words mom one day. And then one day I finally did get pregnant, and I lost my baby at 3 months, and I was absolutely devastated. I've experienced every hormonal issue that a woman can possibly have, so I do understand, and my struggles and challenges have all led me to this moment to help you. Helping women understand and overcoming the debilitating effects of hormone imbalance that leads to infertility has been an obsession for me for well over 15 years. So I've helped thousands of patients get their hormones balanced and get pregnant. This is one of our nurse practitioners who, when she came to me, had really been struggling for quite a while to get pregnant, and I'm sorry to say that I just recently lost her. She resigned from our office, and I was sorry to see her go. But I was so excited to hear the reason was that she was pregnant and she really just wanted to stay home and be a mom. So it's a little bittersweet that I helped her on that path. But, you know, she says that everything she learned through her journey with me and what she teaches other patients allowed her to get pregnant. So I love it when the people that I train and work with walk the walk and then actually get results when they want them. On the right here, is a patient of mine, Allison. She came to me and was pretty much told by doctors that her eggs were too old, that she couldn't get pregnant, and clearly you see from the ultrasound and her baby that she has now that through her process and her journey, she was absolutely able to get pregnant. So these are 2 of my favorite stories that I like to share. So this is me about 10 years ago, and I know it's hard to see, but I really struggled with weight after my hysterectomy, and getting my hormones balanced and getting on that path has really just helped me in the last 10 years exponentially expedite my learning process. And I'm almost 6 feet tall, so I know 80 pounds doesn't really look like a lot, but I know what it is to be unbalanced and not feel good and deal with all these hormone issues. So I love it that I feel great. You know, I'm almost 50 years old now, and I feel great, and I help people feel great as well. I want to start you on your road to regaining your life and healing your body to prepare for the baby that's coming. So they didn't teach me this stuff in medical school. And why? I have many reasons to think that Big Pharma has every reason to keep you struggling so that you'll buy expensive medications, try expensive procedures, and keep hoping. In fact, some couples spend up to $100,000 trying to have a family. The average cost in our country is $10,000 to $12,000 per try for in vitro fertilization, and this doesn't include testing or medications, and it doesn't guarantee any results. But the truth is the physiology is very simple. The truth has always been there right along, and it's a simple matter of understanding how it works. I mean, really works. I think we all know how you get pregnant, but what is the process leading up to that, or the things that might be interfering with your physiology that you may not know, that up until now probably has not been shared with you. The bottom line is if you're struggling to get pregnant, then there's something wrong with your hormones. We have to get healthy and balance your hormones so the pregnancy can happen, and a healthy mom means a healthy baby. You need to understand how hormones work and how to balance them to maximize your efforts. First, let's look at what happens when your hormones get out of balance. A quick method of determining which type of primary hormone imbalance you have is this little picture I love. It's a fun little picture, and you can diagnose your friends and neighbors. But the lady on the far left basically has too much estrogen, or the wrong kind of estrogen, and I'll get into that in just a little bit. But estrogen dominance issues usually accumulate a lot of estrogen around the hips. And women will have heavy periods, they'll have endometriosis, PCOS, because they have low progesterone, and can really struggle with a lot of different health issues. The second woman from the left has adrenal issues or cortisol issues, and she has that whole truncal sort of obesity, meaning the belly to the chest is inflamed and a lot of belly fat. The next lady is a thyroid primary deficiency, and she's kind of diffusely thick all the way from her neck down to her feet. And then I love when I talk about seminars and stuff, talking about the guys too, and sharing a little bit about testosterone deficiency. So if your husband has a testosterone deficiency, that could lead to infertility as well. And one way you might know is if he just has a big belly and he's lost muscle mass. A lot of guys are funny about their testosterone. They're like, no, I'm fine. I have libido, and, you know, they're a little bit challenged by losing their manlyhood. But, you know, if they've started to have testosterone decline, they'll lose muscle mass and they'll start to gain belly fat. Hormones affect every single thing that we do, all the way from our pituitary gland in our brain to our thyroid, down to our ovaries, and our adrenal glands. Our pancreas makes insulin. So all of those hormones directly impact us, and they all have to be balanced. I love this little graph, and I love to show it at seminars because all of our sex steroid hormones that are essentially essential for fertility start from the cholesterol molecule, as you can see up here on the left. And a lot of doctors want to put people on cholesterol medicine, which blocks all their hormones. So, you know, and this is one reason why guys have low testosterone is because they're on cholesterol medication. So it might be something you might want to look at. And then on down the line, the estrogens must be balanced with the progesterones, with the cortisol. So if you're stressed all the time, and that's one of the reasons we address stress, is if you have too much cortisol production, that's going to affect all your other hormones. And then I also like to share with people these three different kinds of estrogen: estrone, estradiol, and estriol. Estriol is very protective for the whole system, and estrone can be very proliferative or increase growth in cancers and tumors and things like that. So if you have heavy periods and you're estrogen dominant, you have lots of excess estrogen issues, it's usually estrone that's the culprit. I use bioidentical hormones in my practice to help people balance out. And one of the main things I want to show you about this is bioidentical means identical to human hormones. And unfortunately, some of the drug companies have come up with synthetic versions because they can patent a synthetic version. And you can't patent and sell something that God made, basically. So they tweak it and change it just a little bit, and then they can sell it. And the difference is absolutely crucial. So from natural progesterone to synthetic progesterone is only a few little carbon, hydrogen, oxygen molecules, and it's enough to change it that they can actually patent it and sell it differently. But the difference is that natural progesterone or progestation can actually help get you pregnant and maintain a pregnancy. Synthetic progesterone will actually cause you to miscarry or kill a baby. So, and synthetic progesterone is in like depot shots and synthetic birth control pills and things like that. So that gives you a perspective. They're actually anti-pregnancy. So the difference is critical. When I talk about estrogens, I mentioned estrone, estradiol, and estriol. And estriol is probably the least active form of estrogen, but it is the most protective. So I like for women to get all three of these levels checked so we can maximize the protective and minimize the most irritative or proliferative one, estrone. Estrone dominance, basically, or the estrogen estrone that causes the dominant effects, can cause water retention, breast tenderness, lumps or cysts, all the way to breast cancer, can cause you to be moody, emotional, anxious, or depressed, decrease your libido, cause fibroids or polycystic ovarian syndrome. So it's probably a very good chance that you're dealing with some of those issues right now if you have hormone imbalance and you're dealing with fertility issues. So the effects of estrogen dominance can be all the way from loss of muscle tone to decreased libido, to increased body fat, all the way to heart disease and stroke. So there's lots of reasons these estrogens get out of balance, and it's most likely because you have too much of the wrong kind, or the estrone of estrogen, and not enough progesterone to balance it out. So in the normal female cycle, the first part of this cycle is driven by estrogen or estradiol, and it causes you to build up your uterine lining. And then progesterone, through feedback from the brain, the pituitary gland, is secreted in response in a little peak here to cause you to slough your lining. So if you keep building up estrogen, 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 you keep building up lining, and you'll have heavy periods, you'll have PMS symptoms, some women even have migraines and bloating, and they just feel terrible because they don't have enough progesterone. And you need progesterone, if you look in here in the middle in the ovary, to make the follicle pop out and to actually make the egg that can get fertilized at ovulation. Day 14 is the day that you ovulate. So this is going to be important in our empowerment series for you to understand. Day 14 is the day that you ovulate, and that's the day that you'll be wanting to have intercourse to get pregnant. So this process of understanding your hormone cycle is very important. Symptoms of low progesterone are basically that you have a lot of heavy periods, or you have spotting, meaning that your luteal phase is usually less than 12 days. You might be craving sugars because cortisol is secreted in response to this low progesterone. You'll have ovarian cyst or polycystic ovarian disease, low basal body temperature because the thyroid is affected by low progesterone or high estrogen, irregular periods, even allergy symptoms can be from low progesterone, joint pains, arthritis, spotting in the days before your period begins from all these irregularities in your hormones and lack of ovulation, and recurrent early miscarriage. Progestation is gestation means pregnancy, so pro-pregnancy hormone is your progesterone. And then you can have blood clots during menstruation as well, and these blood clots can actually cause blood clots to the baby's blood flow if you do get pregnant. So it's very important that you have healthy progesterone levels and cold hands and feet. So when I talked about the wrong kind of estrogen, that estrone, a lot of doctors are not even familiar that, they might have learned this in med school or physiology, but they don't really make it applicable towards fertility or towards hormone balance. So it's very important that you empower yourself and educate yourself that there are three main kinds of estrogen. One kind, estriol, is extremely protective, like I said before, and then the estrone in excess can cause weight gain and, worse yet, breast cancer and all those estrogen dominant symptoms. There's lots of reasons the estrogens gets out of balance besides just low progesterone, but what causes it in the first place? So there's hormones in the food supply, there's pesticides that act like toxins, and we call these xenoestrogens. And these xenoestrogens actually bind to the cell receptor sites just like estrogen, so it's very confusing to the system. And then there's food sensitivities. I'm going to go through food sensitivities in a future webinar and explain that a little bit more. But the food sensitivities can cause a cortisol spike from inflammation. So you've probably heard of gluten sensitivities, things like that. And stress, which can cause too much cortisol as well, can cause too much cortisol hormone secretion, and that throws the estrogen balance off as well. So I love this little cartoon. I'm a little stressed right now. Just turn around and leave quietly and no one gets hurt. There is a circadian rhythm to your cortisol level, so it's normal for you to have cortisol spikes throughout the day, and every time you eat, you get a little cortisol spike. But food sensitivities or gluten sensitivities, dairy sensitivities, things like that can cause abnormal spikes, which throw all your other hormones off. I call this the Pregnenalone stress shunt. So remember I showed you that graph before where all your sex steroid hormones that are directly responsible for fertility come from the cholesterol molecule. So when it gets down here to progesterone and Pregnenalone, Pregnenalone can either go to your sex steroid hormones or it can shunt over to cortisol. So if you have a huge amount of stress or food sensitivities or chemical toxin stress on your body, everything's going to cortisol and not going to make your hormones that you need essentially for healthy pregnancy and maintaining your pregnancy. Cortisol slows the production of IgA, which is an immune system gut protection. It decreases your thyroid production, and it interferes with clearance of your unkind estrogens like estrogens from the liver. Estrogen can slow your thyroid down, and fat causes storage of more estrogen. So cortisol is just this vicious cycle. And I think of the thyroid hormone that I just mentioned before when T3 can slow down your metabolism. Basically, T4 has to be converted to T3, and T4 is like a red bicycle, and T3 is like a red Ferrari. So if you have cortisol and estrogen imbalances, then basically it's like riding a bicycle around all the time, and you don't have much energy or hormone balance, and really what you want is the red Ferrari. So in summary, you must be able to methylate estrogen to be able to clear it, and I'm going to talk about that in a future video. You must upregulate your progesterone, you must decrease cortisol, and you must have a healthy gut. And that has to do with food sensitivities, and again, I'm going to mention that in future videos. But achieving balance of your hormones is not only easy, but essential. So these are great things to know, and in our upcoming little webinars, I'm going to be sharing more information with you. I hope you're not too overwhelmed today, and thank you for sharing this time with me. And I just want to congratulate you on empowering yourself, and I'm so thrilled that you've invited me in to be on this journey with you. So see you soon on some upcoming videos.